Today's Imprint Weekly podcast is brought to you by Accenture. Change is afoot in child welfare. Change that means agencies focus on results for children and keep far more of them safe at home with their own families. Accenture's child welfare team is leading the way in the effort to ensure technology does its part in that success story. Accenture offers cutting-edge case management tools that ensure agencies can see insights that drive decision-making and caseworkers have information they need at their fingertips. Together, these tools help agencies stay laser-focused, reinventing child welfare into a source of strength for families when they need it. For more information, visit www.accenture.com/childwelfare.
Hello and welcome to the Imprint Weekly Podcast. I'm John Kelly, Senior Editor of the Imprint, a daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at the Imprint News. You can also sign up on our homepage for our free weekly and monthly newsletters. And for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business policy and practice. The Imprint Weekly Podcast is also a member of the SafeCamp Audio Network. Check out our show page and all of SafeCamp's other great podcasts at safecampaudio.org on the web or SafeCamp Audio on all social media. On this week's episode, we continue our summer of SafeCamp Spotlights with Adrian McLemore, one of the many hosts and storytellers on Unbelievably Resilient. I've mentioned them many times on this podcast. We had Unbelievably Resilient's Executive Director Carrie Richmond on pretty recently. I personally think this current season of Unbelievably Resilient is the best podcast content on child welfare that I've ever heard. And the episode that focuses on my guest, Adrian, today is right up there among the best of them. Before we get to that interview, let's cruise around a few headlines of late. We'll start with the fact that new data out of the Department of Justice shows the number of youth locked up in adult correctional facilities continues to plummet. It has dropped 14% between 2020 and 2021. As recently as 2008, there were more than 10,000 youth in adult jails and prisons across the country. In 2021, according to the Bureau of Justice Statistics, the total had fallen to 2,250. So from about 10,000 down to 2,250. Nearly all of those youth were held in jails, with only 290 of them incarcerated in an actual adult prison. And that prison total represents a 90% decline from this century's peak of almost 3,000 in 2009. So it used to be a much bigger split, or a more even split, I should say, between the number of kids that were in jails and the number of kids that are in prison. Almost every youth who is locked up in an adult facility right now is in a jail. So a couple of additional thoughts on this. I would start by saying that in 2018, the great legal advocate for incarcerated youth named Neelam Arya published what I would consider to be kind of the seminal piece of analysis on this issue called Getting to Zero, where she kind of proffered her thoughts around what would need to happen to essentially get all but a handful, or really even to zero, the number of kids who were incarcerated in adult facilities. And in her assessment, she kind of expressed a belief that more local information suggested that the federal data very much undercounted the number of kids that were actually locked up. So while the number probably has gone down and perhaps went down proportionally in the numbers suggested, that I just mentioned before, 10,000 down to 2,250, what she was saying is probably it is dropping, but it is dropping from a higher number. I think in Getting to Zero, she suggested that it could be as high as 60,000 kids, at that point in 2018, who were at some point experiencing adult incarceration. But regardless of what number you started from, if you just accept the premise that it is dropping, there are a few reasons why that would be happening. Just to rip a few off, and I'll link to a Youth Services Insider column that we did on this. But, the three big ones, as I'd see them, in the past 15 years, several states have raised the age of their juvenile justice system to include 16 or 17-year-olds. That includes Connecticut, New York, and North Carolina. So before those policy shifts, older teens in those states were just viewed as adults in the eyes of the law, and they could be treated as such, which meant jail, imprisonment, whatever. The second reason would be the fact that many states have kind of limited the pathways that a youth can be transferred into adult court or directly charged in adult court for certain crimes. In this new report, it shows up in the comparative breakdowns that we were talking about between jail and prison incarceration of youth. In 2002, the ratio was 66% jail, 34% prison. Now it's 87% jail, 13% prison. And I would suggest that is largely a product of the fact that the pathway to transfer kids over and originate their cases and try them in adult court have been narrowed in plenty of places. And then I would say third kind of contributing factor, or a likely one, would be that even when youth are charged and handled as adults now, many more states are starting to hold them in juvenile facilities until at least their 18th birthday. So while they may have been tried as an adult, convicted as an adult, they're going to do any time in incarceration, either in a detention center, a youth, training school, or a youth state-run prison for youth only. And this is in part due to some federal pressure related to recent updates to the Juvenile Justice and Delinquency Prevention Act, and then these strengthened standards around the Prison Rape Elimination Act that make housing youth anywhere near adults really a liability nightmare for states. So that has largely helped advocates kind of pressure and convince them it's just not worth the hassle to have them mixed in or anywhere near adults. All right, second headline for today, the Department of Health and Human Services Inspector General's Office drilled down and took a look at the practice of prescribing psychotropic drugs as well as opioid drugs to foster youth in Florida. I read through the intro and explainer of this analysis a couple times. It is not clear to me why they chose Florida and only Florida, because what I'm about to discuss in their findings, I would heavily suspect is present in other states. But what they were looking for was the tracking and recording of these prescriptions of pretty heavy mental health drugs, in some cases antipsychotic medications, as well as opioids for youth in foster care. So here's what they found in an 85 case sample. They found that the psychotropic medications prescribed for 36 kids in an 85 child sample, so just kind of between a third and a half, were not recorded in the Florida Safe Families Network. That's how they track Medicaid claims, I think, for these drugs. Second, the medication logs for 56 children in the 85 child sample were not maintained in the network at all. And finally, the authorization for prescription of psychotropic meds for 33 kids were not contained at all in the network. And then in addition, they found that the opioid medications prescribed for 57 of the 60 kids in the sample were not recorded. So 57 of the 60. So basically, there was no practice of recording opioid prescriptions for youth in foster care in Florida. There's two reasons why the findings here in Florida are a supreme bummer. One is that the Food and Drug Administration recently put out a kind of a cautionary note, basically explaining the danger of mixing prescriptions of psychotropic medications with opioids and the danger and deleterious effects of that, particularly for young people. So that in and of itself is cause for concern. The fact that they found such a high rate of failure to record and track these prescriptions and sign off on them within the Florida Safe Families Network. The other thing is that of all the states for this to happen to, it is truly devastating that it's Florida, because back in 2010, there was a young boy in foster care in Florida named Gabriel Myers who committed suicide by hanging himself from a shower rod at the age of 7. The age of 7. Autopsy revealed that he had had several, not one, but several psychotropic medications, including an antipsychotic, prescribed to him at the time. And this caused a deserved uproar in Florida. And many people gave credit to the system and its leader at the time, George Sheldon, for how they handled that just catastrophe of this child taking his own life while on these very heavy mental health drugs. They popped up a dashboard immediately, prompted a total, a huge task force investigation as to what the practices were, and kept the public and the media apprised, step by step as they went to kind of assess what happened and went to fix it. So the fact that, whatever solutions they arrived at the time, we're 13 years later and seeing a severe lack of transparency and monitoring of these very potent drugs that are not created with children in mind and have very little evidence of their impact positively on kids. Now I want to finish by recommending quite a few pieces actually this week from my colleagues at the Imprint who have been banging out some great stuff over the summer here. Adelia Watson, our New York reporter, was given really great access recently to follow a family's progress as their teenage daughter and the whole family participated in multisystemic therapy, which is often just referred to in shorthand as MST. For those who are not familiar, MST is a well-known therapeutic model for working with youth in crisis, and it is poised for perhaps more involvement in child welfare cases, as one of the services most frequently selected so far by states under the Family First Prevention Services Act, which we've talked about a million times on this podcast. I won't go into all the details, but as you probably know by now, the Family First Act opened up the federal child welfare entitlement, which used to only pay for foster care and adoption, now pays or helps states pay for services that are aimed at preventing removals in child welfare cases. So MST is definitely one of the therapies that's already been approved, has the highest rating of evidence, and really looks to be one of the ones that will get the most investment out of the Family First Act early going. Anyways, the model has its critics, or at least skeptics, about what the research says about its entire track record. And Watson lays that out all alongside a story that really does well to kind of put a face on how this is employed, particularly as a community option. And that's the other context worth noting here outside of the Family First Act and the potential for new investments in things like MST. Locally in New York, there is an ongoing lawsuit against the state filed by Children's Rights and several other partners on behalf of several young people for allegedly failing to deliver on Medicaid guarantees under a Medicaid waiver that the state has secured that specifically pertain to community mental health delivery. And I'll post some information about that lawsuit in a recent event that we held with some youth speakers and one of the leaders at Children's Rights about this lawsuit. But in a nutshell, basically the picture they're painting and seeking relief from is that New York has on paper committed to providing a pretty robust outlay of community-based mental health services to assist kids, particularly kids who have acute mental health needs. And the fact that there are enormous waiting lists to access what is available, the fact, and this is all alleged in the lawsuit, the fact that there's a lack of some of these things happening, even with a waiting list, is causing more parents and more young people to seek care in residential treatment centers, some of them who probably don't need it. And that is in turn creating waiting lists in those places. And that what we see is just this kind of chain reaction down the line. Lack of community health leads to higher demand for residential services, especially among parents who are at their wits' end and just don't either feel safe with their kids, don't feel safe having their other kids around their kid. And everything kind of spirals from there. So again, I'll link to some information about that, but really good profile and just kind of a ground level vantage point on the delivery of community mental health. Next Imprint story, this one's from Farah Mina, who is sadly leaving us for a Fulbright scholarship. We're going to miss her, but that's a very exciting opportunity. And this story is a really interesting look through the lens of Minnesota on a legal offer that has popped up in 22 states now, and that is the restoration of parental rights. The concept is something of a kind of tacit admission that the system does not always succeed in finding permanency once it severs the child permanently from its parents and gives parents a path to appeal their termination in front of a judge. Now, key factor here, this is only, and I'm talking about Minnesota, so I'm sure this varies from state to state, but in Minnesota, this is only a path that's available if there was a termination of parental rights, if 4 years have passed since that termination, and that the child is still firmly in foster care. If the child's been adopted, or if they're even in pre-adoption with a foster parent whose plan is to adopt them and that's moving forward, this doesn't apply. So Mina looked at the data since this law took effect in 2019, and what she found was that of the 17 appeals for restoration of parental rights that were filed by parents, only 2 judges have agreed to reinstate parental rights. So 2 times, 3 of the appeals were tossed out on grounds and eligibility. So basically, 2 out of 14 legit appeal claims were honored by the judge and had the parents reinstated. In the case Mina focused in this story, the youth in question has been in almost 40 different placements with no hope of another permanency option, and the mother was still denied. And you read the story, which will definitely be linked in the show notes. Even their counsel, who are used to losing, there's a lot of appellate loss. That's part of the gig when you're a lawyer. Were really kind of flabbergasted that they lost this one. Interestingly, county attorneys in Minnesota have had this same power since 2014. This is a great detail that Mina unearthed. They have been able to seek reinstatement on behalf of a parent who's lost their parental rights since 2014. They rarely do it. It has only happened 4 times since 2014, so they don't go in there much and fight for a parent to get their rights back. But all 4 times, they have had the judge agree. And I'm just going to quote from Vivek Sankran, who's a pretty frequent columnist here at the Imprint, but was interviewed for this because he's also a child welfare legal expert. He said, "My gut is that this reflects more of what is wrong with child welfare. The courts don't believe facts when parents are the ones relaying them, but when agencies do, they are quick to grant relief." So the fraction is kind of eye-popping within the story, right? 2 times that parents have gone and appealed and sought their rights back, and that's 2 out of 14. But I actually think the 14 is the more significant thing. There are not that many youth who make it to a 4th year in foster care after a termination of parental rights. So it's not like there's this enormous universe of children whose parents this law applies to, but it's definitely more than 14 in a 3-year period. So that raises real questions about whether or not parents experiencing a termination of parental rights are generally aware of the possibility of this law and then seeking, through the appellate process, a reinstatement. All right, and the last Imprint story I want to raise up is Jeremy Loudenbeck's interview with Tamara Hunter of Los Angeles's mandated supporting initiative. That phrase, mandated supporters, coined by Joyce McMillan, prominent New York activist on behalf of parents, who has, used it to kind of coin the phrase to kind of suggest a move entirely away from mandated reporting and towards mandated supporting. Hunter's mission is not quite that. She talks to Loudenbeck about a recent board motion calling for reassessment of mandated reporting in general, ideas around better training of mandated reporters on what is and is not something to report, and the development of a tool that several counties in the state might use as essentially a reporting navigator, if I'm understanding it right. So if you're the reporter, you can kind of plug in information about what you're seeing or what you're concerned about, and that will guide you either to report it, if the guide suggests that, yes, this does rise to the level of that, or to refer somebody to community-based supports, which is an interesting way to go about it. I think Evident Change is the tech firm involved in working with them on this navigator concept. Another way that somebody is thinking about this, Connecticut, we've talked about this on the podcast in the past, is moving towards setting up what they're calling a care management entity, or a CME, which is essentially be a community-based provider who will be the receiver of reports that don't really rise to the level of investigation that could either come into the hotline and then get kind of kicked over to the CME, or from parents or people who directly refer to the CME themselves. And, the idea would be that this entity, when they select it and get it up and running, would not have to open cases or do anything like that to get parents help in a situation where either they or their kids are in crisis. So looks like a lot of different people are coming at this from different angles. And I'm pretty optimistic that in the next 5 years, we'll see probably somebody experiment with getting rid of mandated reporting and seeing really truly how much of an effect that has. Like, one thing we definitely don't really know, because mandated reporting covers so many professionals, is actually what percentage of reports wouldn't be reported if that sort of thing wasn't, in play, that it was mandated. And then I think, again, we'll see people try to, create ways to guide reporters into different ways of thinking than just call the hotline every time. We might see systems think about, how do we create, different pathways ourselves so that we can refer things over. Anyway, it's all very interesting. When we come back, my interview with Adrian McLemore of Unbelievably Resilient. This week's episode of the Imprint Weekly Podcast is brought to you by the National Foster Parent Association. The National Foster Parent Association is a nonprofit whose mission is to be a national voice for foster, kinship, and adoptive families through networking, education, and advocacy. The National Foster Parent Association offers resources and trainings to parents and professionals. To learn more, visit nfpaonline.org. That's nfpaonline.org. All right, time for another SafeCamp Spotlight interview. All summer, we are bringing in hosts from SafeCamp's inaugural group of member podcasts. You can check out all these podcasts at safecampaudio.org, and we are regularly promoting and featuring their work on social media. You can follow us on any of the big ones at SafeCamp Audio. Today, we have Adrian McLemore, who is one of several hosts, storytellers, I think you guys refer to yourselves as, involved in Unbelievably Resilient, in which alumni of the foster care system offer a safe space to commune, laugh, and share stories of resilience. Adrian, thanks for jumping on the Imprint Weekly Podcast with me.
Thanks for having me. And yes, you stole everything I was going to say, John, so I can log off now. Yeah.
Well, okay. Take it easy. Yeah. Well, let's start with you so they get to know you a little bit. Rules on our podcast. This is for everybody because, we get into some serious stuff. I like to just get a baseline, get them to know something about you. I'm going to give you the categories. You got to give me one favorite at least. You can give me more if you want. TV, show or movie, sports team, musical group,
of course,
or book. I have a feeling since I've listened to this season, I know what's coming on music. And I'm looking at a hoodie that Adrian is wearing that gives it away, but maybe he'll give us more than just that. But go ahead.
I'll give you a few more, John,
right.
since you've already, spoiler alert for one of the episodes we did this season. So favorite TV show is The West Wing, a classic NBC show. Love that show. It's about the American presidency and the executive staff of The West Wing, starring Martin Sheen, a whole bunch of Allison Janney, and a whole bunch of other folks. So love that show. Favorite book is actually a book called Meditations by an emperor, the Roman history or empire, named Marcus Aurelius. So it's just a book on philosophies and living. And then favorite sports team, even though I live in Maryland, and I'm not supposed to say this out loud because I'm supposed to be a Baltimore Ravens fan.
Oh my God, are you about to say Commanders?
No, God, no. I am a huge Denver Broncos fan, and there's a connection that the Ravens beat us in a playoff game years ago, and I've hated the Ravens ever since before I moved to Baltimore. So I have to be very careful when I say that out loud in some circles here in Baltimore. But Denver Broncos, and then last but not least, the giveaway, spoiler alert for an episode this year on our podcast, is I'm a huge fan of Bruce Springsteen and the E Street Band, who are currently on a world tour, as am I.
Yeah, so please, we'll talk a little bit more about Unbelievably Resilient, but the episode he's talking about is a deep dive on Adrian, which you could tell he was super excited to do, really talk about his life in public, which I thought you did a great job considering that's not your bag. But it was also just really amazing to hear these two young women try to comprehend the idea of literally going around the world with one group as opposed to just catching everybody while they're around, Yeah. It's pretty funny.
Absolutely. It was a fun conversation with Raya and Carrie, two of the other hosts. Carrie serves as our executive director. No, but the band has been one of my favorite groups, not just Bruce, but just the musicianship. And so when they announced the world tour, of course, John, we've been living in a pandemic for the last few years. They were supposed to have been on tour. And I said, I will go to as many shows as I can. And so it'll be my first world tour. It was my first world tour, and been to a whole bunch of stops. And in a couple of weeks, I go to another stop in London.
Nice. We'll have fun with that. So describe Unbelievably Resilient to our listeners in 3 sentences or less. Give them the elevator pitch of what you guys are about.
Oh, wow, John, you're good. So those 2 sentences don't count. So first I will say we are amazing storytellers who tell stories from a place of strength. And it's a fantastic podcast of alumni in foster care who are just fantastic. And I think that's more than 3 sentences, but sorry.
No, that's good. Brevity was what we were looking for, and brevity is what we got there. When did you guys start, and how? I'm super interested in this because I don't know the origin story, but when did you guys start the podcast and how did it come about? Like, how did you guys get the people together with the idea?
There's a film director, Sean Anders, who wrote a great film called Instant Family, starring Octavia Spencer and others. Fantastic movie. And after that movie, it shares a little bit about his story and the adoption process and his family. And so he wanted to do more after the film was finished and launched. And he got together a few alumni people. And then we sort of met in DC, had dinner, discussed the organization. It was under a different name back then. And then it sort of morphed into this. We are in our third season of the podcast, and we have hosts and team members from all across the country, all the way down there in Texas to Florida to Portland, Oregon to right here in the DMV. And so it's just a fantastic network. Former alumni who want to share their story from a place of strength, who aren't afraid to talk about what happened to them in foster care, but also add brevity and humor and all of the above in terms of just telling our story, what it was like to grow up in the foster care system, and also advocate for positive change and help others find the strength to tell their stories as well.
I'm going to shine you guys up a little bit here for a second before I ask my next question, because I was just talking to somebody about this season last night. And I said, I compared it to The Simpsons, where like, if you go back and like the old school Simpsons, from like seasons 1 through 4, they're
Okay.
still funny, but it was
Mhm.
like when Conan O'Brien and all the like brilliant writers started to jump on, that it got like iconic.
Yeah.
I think you guys are in that stage with season 3 to me. I think it is must listen for anybody that's involved in any way with this child welfare system. I think you guys are doing such a good job of having it be conversational, but in a way that it's so clear that you guys are preparing these and like threading them through through lines, whether it's talking about one of your guys' lives specifically or whether you're talking on a topic. I thought yours was incredible. I thought the episode where they were talking about case histories, something we want to write more about in the Imprint, because that is just such a ignored. It's ignored. And like, I think you guys are raising up stuff that nobody has. So I just think it's like a really important season right now.
Yeah, you're bringing up some good points, John. The first season was rough. One, we were still in the middle of the pandemic. That's the first thing. The second thing is we didn't know each other. We all had our own backgrounds, our own stories, and we were sort of came into this room and said, "Okay, here's some microphones. Have at it." And so we spent that first season working through a lot of tech issues. Right, first thing, working through a ton of tech issues and equipment and construction. But then the beautiful thing about that is we built relationships with each other, and those relationships gave us the ability to understand the nuances of our personalities and how we think about the episode, how we want to structure the episodes. And so I believe you're right. This season has been fantastic. We have a lot of new spotlight episodes where we're highlighting hosts from all across the country who are part of our organization. And I think that we are diving deep into what makes us us and sort of where a lot of that stuff comes from. And then it's also a lot of processing for us as well in terms of, wow, I never thought about it that way. Because when you get added perspectives from a shared experience like foster care, I think it makes for a great conversation, and it's a great tool, and it's a great listening endeavor for me as well. I don't like the sound of my own voice. So Carrie and Raya begged me and said that I had to do it. And so I listened to of course, you always listen to the ladies, and I finally did it. But I listened to all the other episodes, and they are fantastic. We have fantastic episodes with Lino and Slam and Riot, Ivy, Marie. It's just, we're just a really, not to toot our own horns, we're just a really cool,
No
it's
doubt.
kind of amazing when you step back from it and just put on your headphones literally and just listen to folks share their story.
So in that vein, I will not make you alienate any particular guest or co-host by forcing you to pick the single favorite episode trope. I'm going to ask it a different way for you.
Yeah, good.
Which episode so far stands out to you as particularly an embodiment of what you're trying to do with Unbelievably Resilient? Like, if you had to tell people, listen to this one, this will give you a really good indication of what we're about, what would it be?
It would probably be, I'm not sure what episode number it is, but I think it's the episode where we talk about, I wasn't on this particular episode as a co-host, but my friends talked about storytelling and stereotypes. And I think that was a very powerful episode, because society in general has a pretty singular perspective of what it means to grow up in foster care. And we are in this new space of telling authentic stories about our experiences, but also what other folks go through. And I think that aspect of it was a very, very powerful episode. And so that's probably a good one. And then another shameless plug, all these spotlight episodes where you dive deep into someone's personal story, because as you know, John, from being in this space, personal stories captivate people, and where people come from and why they are the way that they are and why they think the way that they think. And it's amazing because all of our stories end from a place of strength because it didn't start there. And so we talk about in this season, what it took us to get there, and in a lot of cases, what it's taking us to stay there. And I think that's probably the best thing.
I'm going to ask you a big philosophical question outside of the podcast realm. What are you? Yeah, I'm not picking on you. I've asked a couple of hosts this.
Oh no, go ahead, man.
What are you most optimistic about, and what concerns you the most about the child welfare moment that we're in, the system as it is today?
So I'll start with the pessimistic version first, and then I'll end with the optimism. The most pessimistic version that I have of the child welfare system, that we still, in a lot of areas, still do it the same way that we've always done it. And that old quote, the definition of insanity is doing the same thing over and over and expecting different results. A lot of times I feel that way about child welfare in terms of how we engage birth families, in terms of how we focus on making sure that young people are prepared for adulthood, especially in our opportunity range ages of, at 14 teenage years before they get ready to leave the system. We still have dismal results when it comes to young people aging out of the foster care system. So that's the pessimistic side of it. What I'm optimistic about is I continue to see, not just in this life of podcasting, but also in my day-to-day life as a professional in the field, is I continue to see that there are more and more advocacy groups popping up, that there are more and more people who are willing to share their story, that there are more and more people willing to work on policy reform and change, and there are more and more people who are getting in the field who have lived experience, which I believe is critically important to changing how we think about child welfare. You have folks who have gone through the system who are now working their way through the ranks of becoming social workers, who are working their ranks to becoming executives in child welfare, who are working their way through becoming policymakers in the child welfare space. So I'm optimistic about that aspect of it, and that the system, hopefully over the long term, begins to produce better outcomes.
So we've launched the SafeCamp audio network to really feature shows on a variety of topics within child welfare and youth justice, although there's really not a lot. With youth justice, it's really building some podcasts, honestly, because they don't exist. You all, of course, do a great job in raising up this perspective already about young people have experienced it. We have a show on parental rights. We've got one that's really hosted by lawyers for children. I'm curious for you, is there a specific topic or type of podcast show you'd love to see somebody take on in this space? Something you feel like would be ripe for this medium?
Yeah, I think that we need to continue, as I just mentioned, to work on our older youth population. So, and our cross systems youth. So young people who are not just involved in child welfare, but young people who are involved in juvenile justice system, because there's a lot of correlation between the two and addressing those issues. And then post-secondary options. And I don't mean post-secondary in terms of education, but I mean post-secondary in terms of making sure young people are prepared when they leave the system, whether they're going off to college, whether they're going to get a skilled trade, whether they're taking a gap year, whether they're still trying to find themselves, whatever that case may be. I think that is very, very important. You Are Unbelievably Resilient focuses on the alumni aspect of it, which is fine and great and where we are in our lives. But I do believe there are plans for a couple episodes that we have where we're going to be talking about those issues, but more importantly, that space in general, cross systems youth and youth, what happens once they leave the system.
All right, the show is Unbelievably Resilient. He is Adrian McLemore, one of the many personalities, storytellers behind this project. Like I said, this season is it's a banger. Go listen to all of them. Adrian McLemore, thank you for joining us on the Imprint Weekly Podcast.
Thanks, John. Thanks for having me.
Thanks to Adrian McLemore, a host on Unbelievably Resilient, for joining us today. The Imprint Weekly Podcast is a production of SafeCamp Audio Network, which is the division of Fostering Media Connections. Please visit safecampaudio.org on the web or SafeCamp Audio on all major social media. This podcast is produced and mixed by Christine Onjoko, with music by Luke Giroux and Cyrus Elliott. If you enjoyed this episode, we would love it if you consider subscribing or giving us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. And we'd really appreciate if you consider supporting our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow and cover more great stories in child welfare and youth justice. To support us, it's very easy. Just visit imprintnews.org/donate. You can follow the Imprint on Twitter and Facebook by searching the handle @theimprintnews, and visit us on the web at imprintnews.org. You can always email us at tips@imprintnews.org. I'm John Kelly, and we'll see you next week.